Topic is dilated abdominal wall vein. Hello dear students, today we will discuss a very common clinical sign in the abdomen related conditions. Especially there is some problem with the major vessel circulation, venous circulation, that is IVC, inferior vena cava. So what is this clinical finding? Just look at this. See that here dilated abdominal veins. See that umbilicus is here, nipple you can see that, and you can see that. So normally umbilicus is the watershed area and clavicle is the next watershed area. Above the clavicle, venous drainage is into the IJV. From the clavicle to the umbilical level, venous drainage is into the superior vena cava. Below the umbilical level, venous drainage is through the IVC. Finally, it enters the right atrium as such. So IJV, SVC, IVC, three levels. So below the at clavicle level, clavicle to umbilicus, below the umbilicus. So if there is any obstruction in the IVC, then lower part, lower limb blood, lower part of the below the umbilicus blood, venous blood drainage has to occur by some other collaterals, that is through lateral abdominal wall veins, which again connect into the superior vena cava through the vena cava drains. Same thing, in reverse direction can occur if there is SVC obstruction. So it is a body mechanism which compensates for the obstruction in case it occurs. So there are dilated veins. Always we check the normally blood flow is above the umbilicus upward, below the umbilicus downward. Whereas here reversal occurs in IVC obstruction, it is throughout upward or toward downward in SVC obstruction. So it should be checked always in standing position. That is a clinical point which you have to always remember. And normal flow blood is upwards to the superior vena cava, above the umbilicus, downwards, and downwards below the umbilicus. That's already told, I said watershed area. And so check the direction of the flow is very, very important. Two finger, open it like this, release, then see the check. And again opposite side to see, then you can see the direction. Many times you have to do in different places. Do it here, do it here, do it here, so that you can see that. Below the umbilical level you have to check. At least two places you have to check, above the umbilical level. Then you can see there is a normal venous drainage or reversal on either side. We can depend on the IVC obstruction or SVC obstruction. So checking is important with the two fingers, milking the two fingers, releasing in two direction, at the below the level of umbilicus and above the level of umbilicus. And all these things you have to remember how it happens. Venous drainage occurs through long saphenous vein, superficial epigastric and circumflex vein, lateral thoracic vein, axillary vein. Dilated veins are seen in paraspinal and lateral wall of the abdomen with upward direction of blood flow. This is a pathway which you have to remember always. Often asked in the MCQ, why also they will ask. There is a pathway direction I have put in the SVC direction in the other way. Whereas Caput Med says in a normal direction but dilated vein in the case of portal hypertension. Seen in the way of the umbilicus. If it is the umbilicus like this. This is a very typical Caput Med say. It's typically seen in the portal hypertension. So there is another thing you have to look for, not a feature of obstruction, either IVC or IVC or SVC. So answer the MCQ. Most common cause of Budd-Chiari syndrome is A, oral contraceptives, B, polycythemia rubra, C, schistosomiasis, D, neoplastic encroachment. So students, put it in the comment box. I will get back to you with the answer later. So students, go through my SRB's clinical methods in surgery, which has got a video lectures of each topic. So many topics are covered. Every topic as far as CBM syllabus is covered. How to examine the patient. Swelling, ulcer, arterial disease, venous disease, thyroid, breast lump, mass abdomen, briefly orthopedic, every system, whatever your required thing, everything is covered. There is a video of how to examine of each topic, and principles of examination is good, and differential diagnosis in the table format is given, and briefly investigation. Suppose treatment is not a topic will be covered in a clinical method examination, remember. And many photos of the most of the conditions with the illustration. Photos will tell the clear idea about for the students how exactly condition looks like. So covers everything with the beautiful photos, and it also gives the instruments, specimens, then operative surgery briefly. Everything is covered. Small images also it is covered. So it is more than sufficient for all undergraduate, postgraduates of any system to learn very basics is the required thing for the surgical field is clinical methods. So please go through that and purchase that and make use of it. My SRB Manual of Surgery is very popular. It covers a theoretical aspect, everything, principles, treatment in detail, briefly technical aspect, and with the photos, illustrations, quotations, all topics with the specialty, urology, cardiothoracic, neurosurgery, and operative surgery instruments. Again, it is covered in this book also. Every quotations, and you should else worldwide also, actually including our country, everywhere. And please, you can make use of it. My operative surgery book, SRB Operative Surgery Atlas, that is a 2-volume book, covers in detail operative technique of surgery, all surgery, small surgery, major surgery, everything, with total around more than 10,000 illustrations and photos. It gives very good principles and technical, step-by technical aspect. Very, very useful for postgraduates. Not much useful for undergraduate, but it's a postgraduate book and consultant book and learner after MS. It gives everything. You can, before going to surgery, you can always read this book and memorize your steps and do the surgery properly. Every topic, general surgery, gastroenterology is covered in detail, step by step with illustrations. And my SRB is Atlas of Tissue Approach, small book, Atlas, 100 pages, how to do the suturing, tissue approximation, including laparoscope suturing with the video. It is covered. So any basic learners, suturing is very, very important surgical field as a skill actually. Dissection and suturing, so the two parts of the surgical skill. So that is also covered very well with videos. You can always go through that. And my website, please subscribe, all of you. Your daily lectures are there, live sessions are there. My Digihour lecture through JP Publishers, around 220-hour lectures. Entire thing as for CBM is covered with the examination part, with all topics of CBME, ulcer to operative surgery, instruments, specimens, examination, specialties, basic, everything is covered. You can always purchase for 1 year and have a clear idea about the surgical topics, understand very well, and helpful for your exam, NEET, MCQs. Also, it is there both in manual and my lectures. So students, I hope you have understood this lecture very well. Thank you very much.